Good afternoon, everybody. As President of SOM, I'd very much like to welcome you to this afternoon's Public Health England SOM webinar, and it's the third in this current series. The topic for this afternoon's event is managing job insecurity and creating better quality work. Please can I ask everyone to set your microphone to mute unless you're speaking. It limits the background noise. This webinar aims to inform policy and practice and is of particular relevance to a number of people, such as workers whose jobs may be under threat, very stressful on top of COVID, probably because of COVID as well, managers, HR and occupational health professionals, trade unions, businesses that use contract workers, and those who are self-employed. We have three speakers this afternoon. Professor Jill Rubery of the Work and Equalities Institute of the University of Manchester. The Institute's research agenda aims to develop new interdisciplinary approaches to addressing core policy and intellectual challenges. Professor Bevan is Head of HR Research Development at the Institute of Employment Studies, with responsibility for developing innovative new projects and programmes with IES partners and collaborators. Stephen returned to IES in April 2016 after having spent 15 years as Director of Research and Managing Director at the Work Foundation. And our final speaker is Henry Chango Lopez, who is General Secretary of the Independent Workers' Union of Great Britain. Although currently General Secretary of the Union, he first joined in 2013 and has played a key role in its campaigns and a significant growth in membership. So, just a reminder about switching off your microphones, please, and for the speakers to switch their phones off as well. I'd like to now hand over to our first speaker, Jill Rubery, of the Work and Equalities Institute of the University of Manchester. So over to you, Jill.
Thank you very much. And let me share my screen. Is that, can everybody see that? I will move it.
Yeah, that's fine.
Slideshow. And because I've had, sorry. I'll leave that. Thank you very much. I'm hoping my internet remains stable. It was having problems a few minutes ago. And if any funny noises, suddenly somebody seems to be cleaning the windows outside my house. One of the things, the risks of webinars. Right, I'm going to talk today about the implications of precarious work for equality, health and well-being under COVID-19. And the first thing is to sort of identify what is precarious work. Well, my approach is to recognise that work can be precarious along different dimensions. Sometimes work is only precarious along one dimension, and in other times it might involve many dimensions. Thinking about wage income insecurity, adequacy, working arrangements with a good personal.
Jill, perhaps you can switch your camera off, your connectivity's fading.
Fine, just a minute. How to do that? I've lost the thing where I can see how, right.
Yeah.
Okay. That help? Is that
It's still there. It's at the bottom of the screen in the left-hand corner.
Have I? I thought I can't see myself. I think the video is gone.
Okay, we've just got a picture. Oh, now it's gone. Brilliant, Jill. Thank you.
Sorry. Right. Let me. Okay. Sorry. I think I've. Right. You need to go back a few slides. So I'm looking at these different dimensions, including lack of access to social protection, unhealthy and unsafe work environments, and indeed, of course, unfair treatment of at work, such as lack of respect and dignity. I think it's important to recognise that precarious work is often found in non-standard forms of employment, such as part-time, fixed-term, temporary, casual, agency, zero-hours contracts, freelance, gig economy, solo self-employed, and the like. But we also find it in open-ended full-time employment in various areas where there's low value-added markets, tight budgets on outsourced work, and the like. And why has it grown? Well, I won't go into detail here because I need to catch up on time, but the demand side of the economy has been changing. We've had the growth of services, the 24-hour economy, globalization that leads to both competition and a wider range of hours of operating for many organizations, and fiscal incentives to create low-wage jobs and to use freelance and solo self-employed, which are a particular issue in the UK. But we've also got an increasingly diverse labour supply. Some people don't necessarily want regular employment, such as students combining work with education, but to some extent they spoil the market for others, like young people who do need a stable job, but may find they have to take a precarious job, an insecure job, because there are plenty of young people out there, if you like, willing to take precarious jobs. Older workers need to stay on. Those on universal credit have to try and top up their hours where possible. And of course, there's discrimination in access to standard jobs, and people may find they cannot secure a good quality job. And then there's the issue of mothers who have the main responsibility for childcare and cannot cope with long hours and high costs of childcare, and may find themselves obliged to take a more precarious job. Now, precarious work has implications for health and well-being, both under COVID and, of course, pre-COVID. And there's a recognition by the Association of Health Professionals, that's all the Royal Colleges of doctors, associate professionals and nurses, that in fact, good work is essential for improved physical and mental health. And some research evidence suggests that mental health has even more association with precarious work and job insecurity than physical health. We also find that particular kinds of precarious workers, for example, agency workers, may be left out of health and safety training or receive poor quality personal protective equipment. And agency workers have also been found, for example, to be less likely to take sick leave, a form of presenteeism. They fear leaving work, not being at work, they may lose their jobs. But let's turn now to precarious work and COVID-related risks. There are two, first of all, on job and income security, there's a greater risk of job loss in most of the studies, and I'll just leave those on the screen for you to read, for those in low-paid jobs. Those with low guaranteed hours, obviously more at risk from cuts to hours without any redress with their employer, no change to the contract. They're more likely not to be eligible for statutory sick pay. The TUC has estimated around 2 million people have not access because they earn below the national insurance threshold. There's also evidence of a greater fear of job loss, especially those on furlough. And the CIPD found that 3 times more than those working in the first phase of the lockdown feared job loss. There's a greater risk of not being included in furlough. It's interesting that the UK government did allow 0 hours and freelance 0 hours workers to be included in furlough, but they were often not, from anecdotal evidence at least. And freelance workers may just not get any work. There is also no actual right to furlough, even though it's allowed by the government for childcare reasons. That contrasts with 20 of the 28 member states in the EU that did provide childcare leave as a right. And the TUC has found in a recent survey that 7 out of 10 mothers who responded to their survey had their request for furlough refused. And then there's a lack of eligibility for some of the self-employed for the self-employed income support scheme. Those who work on short contracts but included on the PAYE system are often not included. Those who have newly entered self-employment, and indeed those who earn more from their self-employment as directors of companies, are also excluded. Another set of risks is the risk with self-isolating. I've already mentioned they're more likely to be ineligible for sick pay. That's due to having low pay, so they fall below the threshold, or irregular employment records. And indeed, the self-employed are not eligible. But another problem is that if they are eligible, they're almost certainly only get the statutory sick pay, and they're less likely, which is very low in the UK, and as I'll show you in a minute, and less likely to receive employer top-ups to statutory sick pay. And sick pay isn't even available unless you're personally sick. So not for being in contact with someone with COVID or caring for self-isolating children. And there's been a lot of discussion in the papers today about the lack of eligibility for the new supports, or the support scheme introduced of £500 for those who are self-isolating. But there are many restrictive regulations that you have to fit in with in order to be able to claim that benefit. And something like 70% of claims seem to be being turned down. But there are some people who are not eligible at all, and that's parents providing childcare during self-isolation. And yet we shouldn't be encouraging parents to leave children on their own. So even if people in precarious jobs receive sick pay or the £500, they may still lose income because £500 for 2 weeks is still a low level of income, less than minimum wage. And they're less likely also to have savings and resources to fall back on, and more likely to be in debt. So these are major problems. And there is some right to take emergency leave to arrange emergency care, but how long that should last is really at the discretion of the employer. So the fear of job loss is really strong. And that's particularly the case if you've been in work for less than 2 years and continuously with one employer, which is going to cover a lot of these people in precarious work, because then they're not eligible for protection against unfair dismissal, apart from on grounds of discrimination. This slide just very quickly shows you how sickness benefits relate to the average earnings. And you can see the UK is the second to last on the right-hand side and only provides a 20% of average earnings in sick pay, whereas many of the European countries provide at least 50%. The vast majority provide 50% or more, some even up to 100%. So you can see how limited our sick pay arrangements are. And then the final risks are related to health. Many precarious jobs are frontline jobs, but some of these were high risk for health pre-COVID, but many have become high risk because of the fact they're actually in the front line and meeting all kinds of people on a regular basis. Another problem is that because of these issues of self-isolation, many of their colleagues may not be self-isolating, even if they're not working with many people of the general public. And job loss and fear of job loss and income problems is well known to be leading to mental health problems. And these are going to be particular problems for those in precarious jobs. Health and safety at work is obviously more important in a pandemic, but the inspection rate decreased well before COVID hit. There was a recent 28% decrease in the number of inspections. And my understanding, it's not my area of research, but my understanding is that most of the new checks on health and safety are being made through call centres and not through visits. And so they're dependent on the responsibility of the employer, which is going to be a major theme in my last part of the talk. And many in precarious jobs are at risk due to personal characteristics. It's associated with Black and ethnic minority communities, but we don't have enough evidence yet to know exactly whether those risks are only a function, if you like, their work and social conditions, their inequalities, than anything to do with demographics. Those with disabilities or health problems are less likely to be in full-time work, but they're also paradoxically less likely to have good rights to sick pay and job protection when they're perhaps the group that will really need them. So this slide just shows you the impact of losing jobs. Some research that I was involved in, looking at what happened between January, February and April 2020. And if you can see on the left-hand side, those who left paid work during that time period had the worst mental health. That's a mental health scale, and the higher the bar, the worse the mental health. And that was worse than those who'd remained unemployed and those who'd furloughed or remained part-time, or even who'd moved from full-time to part-time, or who had remained full-time in employment, who had the best mental health outcomes. So you can see that actually what's happening in the workplace, whether you're losing jobs, being furloughed, etc., does have an impact on mental health. And consequently, we have a major need for, in the UK, to have responsible employers. I'm focusing in this last part on responsible employers because we don't have that many direct rights for workers to be able to protect themselves. We will have a talk later from a trade unionist about the need for trade unions to try to protect workers in these conditions. But I think it's worth recognising how reliant we are in the UK on employers acting reasonably responsibly, and many of the time they would be acting perfectly legally not to be taking these responsible actions. But given at the moment, responsible actions have spillover effects, not just on the individual workers concerned, but on the wider community and society. It's really important that this need for responsible employers at the moment should be made clear. So I'm going to look at their responsibilities and how they could reduce physical health risks, mental health risks, help the protection of children, and promote more equality. Some of you tuning in here may be employers, and I hope this is useful to you. Others who are not employers may just be, I'm hoping to make you aware of what kinds of things employers could do, perhaps with some intention that you could actually try to negotiate and discuss with them these kind of policies. So if you were a responsible employer, how could you reduce physical health risks? Well, the first and most obvious thing is to enable staff to self-isolate and to care for self-isolating children. Given our current protections are weak, we need employers to support their workers in this. We also enable them to, we also need them to enable staff to look after their own health. They need to attend vaccination clinics at the earliest opportunity and not fear that if they were to not be at work, that would endanger their jobs. Staff need to be enabled to work at home whenever possible. And sometimes that would require support through loans of laptops, help with costs of broadband or 4G and other factors. We hear about this about school children, but it also applies for those in low paid and insecure work who haven't necessarily got access to this kind of equipment. We need employers to identify problems in relation to travel to work and other risks and try to mitigate those risks. And obviously we need them to ensure a safe working environment. And I've already stressed the issue of the checks on safe working environments are coming through call centres, not through direct inspections. Employers can also do things to reduce mental health risks. I think the first thing is not to treat precarious jobs as unimportant to the individuals and their families who hold those kinds of jobs. Just because they're low paid and perhaps short hours doesn't mean they're not important for putting meals on the table. They're particularly important now. There are a few alternatives and vacancies. Often people in insecure jobs in the past would feel relatively comfortable in perhaps losing a job because they would be able to pick up another insecure job somewhere else. But those jobs are disappearing. And so it's important that whenever possible, these workers are included, for example, in furlough schemes, rather than just simply ending their jobs. They will unlikely to be eligible for any redundancy payment or any consultations over redundancy. Another thing employers can do is to minimize job losses. And if necessary, and it's happened in the aerospace industry, considering sharing work among all staff. Evidence indicates, as I've already shown you, that job loss is worse than furlough or reduced hours. And maybe staff would be willing to combine together with a 10% reduction in order to reduce the likelihood of a 10% redundancy. they need to, employers also need to communicate their future plans to staff and allow staff to discuss their concerns and priorities. It's important to not for staff not to hold unnecessary fears, but also for them to have an honest answer about future prospects. And they also need to make adjustments to enable the continuation of work during school closures or isolation, and to communicate that when they make adjustments, that this isn't setting people up to be particularly vulnerable to job loss in the future. I think employers also have a responsibility to protect our children. It's particularly helpful if they could do what's possible to enable fathers as well as mothers to combine work and care, because obviously the burden is lower on mothers and on the employers of mothers if employers also allow the adjustment for fathers. And also to recognise that it's not necessarily sustainable long term to have a full double shift of childcare and work, and to take account of the effect of that on the burnout of their workers. And finally, we need to think about how employers can take action to promote more equality in the COVID impacts. And the first thing, as I've been stressing, is perhaps to treat all staff the same, regardless of whether they're on standard or non-standard contracts, not forget about the non-standard and just allow them to be job loss or lose hours. And to recognise there are greater risks for some workers, but not to stereotype. It may be important, for example, to ask single mothers if they want to reduce hours because of the childcare pressures, but not to impose that, because it may be very difficult for those single mothers to survive on lower income. Likewise, to be aware of greater risks of Black and ethnic minority groups, but prioritise making the work environment safer for all and enabling self-isolation, and not focusing on exclusion by individual characteristics. And finally, where there are opportunities for jobs, to open these up for young workers who have suffered most. Nobody is really joining the Kickstart scheme for young workers. That's something that employers could think about and consider them for future vacancies. Thank you very much for listening.
Thank you very much, Jill. That was very interesting. And what I found particularly gratifying was there's a number of things we've done at SOM which really do pick up some of the points that you've been making. So I'd now like to just point out that if you're not already aware of it, at the bottom of your screen is a little bubble, if you hover your cursor, that says chat. If you've got any questions that Jill can answer, please can you write them in that box now, and then they'll be fielded over to me to then put them to Jill. One of the comments that was made by Nuzat Ali, who's from Public Health England, was saying that female mental health is worse across all areas. And why do you think that might be? So I'm going to pose that back to Jill while we wait to see if there's any other questions that come in.
I'm going to try my video and hope that I'll take it off if it starts being unstable again.
Do you want me to repeat the question?
No, I heard it. It's okay. I think, I mean, mothers have been bearing the main burden of childcare. I think it's interesting that actually there's some evidence that in the first phase, at least, fathers also increased their involvement in childcare, but nevertheless, the biggest increase was in number of hours, not as percentage, was for mothers. And I think that is clearly leading to problems of mental health because of this juggling of the two demands. I think it's also a long-term worry. Childcare infrastructure is not very stable. They've had financial problems. People can't necessarily afford to pay for the childcare. There must be concerns about loss of jobs because of the sectors in which women are concentrated, the service sectors that have suffered particularly. So there's lots of reasons. It's not going to be one reason, it's going to be a whole raft of reasons for different groups of women.
Thank you. I've got a question here from Laura. At least I think it's a question, I'll read it. Working in the construction industry, there is often a long supply chain under the principal employers, with self-employed staff at the very bottom of that chain. Even though the employers may be responsible, these benefits do not often reach the self-employed staff at the end of that chain. Do you have any recommendations on how this can be done and improved?
Well, I'm not an expert on what all the problems on the self-employed income support scheme. I actually know more about it on the gender side because of problems of women who take maternity leave and then they find they had low profits the year they have maternity leave, so they don't get any income this leave. But there are problems in the self-employed income support scheme because of the need to look at profits over the last 3 years and how long you started. So, but maybe some information to those workers that they could claim those that support might be helpful. I think the main employer or the on the site is responsible for the health and safety of all, even if the individual subcontractors will be responsible for looking after their own, if you like, staff. So I think I've been advocating for a long time more joint responsibility amongst clients and their outsourced companies for many aspects of employment, because often somebody who's working as an agency worker or freelance on the site of a client is being directed by the client, but it's the client responsibilities to them are limited. And so it's a complicated situation. And that's something I think we need to look at in the post-COVID era of how we can make these complicated arrangements along supply chains better for workers where there's more joint responsibilities.
Thank you. One last question in the last 2 minutes allocated to this slot comes from Juliet Rodriguez Guzman. Hope I pronounced that correctly. Have you any evidence of these impacts in developing countries in other parts of the world?
I haven't been working on that directly. I think if you're interested in that, you could have a look at the International Labour Organization's website. They are monitoring all kinds of information about what's going on with COVID across the world. That's the International Labour Organization, part of the UN, headquarters in Geneva. And they have very interesting websites on the policies that different countries are adopting to support COVID, people under COVID. But I'm pretty certain there will be stuff there about what's happening on job and income insecurity, etc. So I'd recommend you look there. I'm afraid I haven't been looking myself at that aspect directly.
Thank you, Jill, and thanks for a very interesting presentation. I'm looking forward to going back and re-listening to it so I can get the full impact of it. I'd now like to pass over to our second speaker, who's Professor Stephen Bevan of the Institute of Employment Studies. So over to you, Stephen.
Hi, everyone. Just sharing my screen. Hope that works. Can you see that okay?
Yep.
Brilliant. Thank you. And thanks for the invitation to speak and to share a platform with someone as eminent as Jill, whose work I've admired for many years. It's great to meet her virtually. And I'm hopeful that there'll be quite a lot of constructive overlap between what I'm going to say and what Jill has said. And no disagreement, I don't think, on the description and the diagnosis. So it will, of course, come as no surprise to anyone that precarious work and job insecurity can contribute to poor mental health outcomes, together with financial instability, higher risks of underemployment, and a potential for further detachment from work, which is intrinsically meaningful. The case against precarious work is well known, and it's led to a number of campaigns for greater regulation or even bans on 0 hours contracts and so on. I suppose it's also inevitable that the debate about precarious work has, in some cases, become politicized, with some arguing that, left to their own devices, firms will always seek to transfer risk to workers, especially during times of labour surpluses. And others argue that adopting a sort of core and periphery model of flexible resourcing is a rational response by companies to uncertain and fluctuating levels of consumer demand. So this has been part of the discussion about labour economics and the structure of labour markets for many years. And I'm not going to get into that, into the detail of that today, though others might. Instead, I'm going to talk about whether there are common features of precarious work which seem to affect mental health more than others, whether the link between precarious work and poor mental health is inevitable, and what the messages are for employers and policymakers as the UK labour market makes a slow recovery as the COVID-19 pandemic releases its grip, as we all hope it does very soon. Just a bit of context. We know that across most European countries, non-standard working and precarious work was on the increase, certainly in some sectors. Although it's worth reminding ourselves that in aggregate, it still represented a relatively small proportion of total employment. In the UK, I don't think the gig economy, if we can use that umbrella term, has ever been higher than about 4% of total employment, but it's obviously very significant in some sectors. Of course, the other thing to bear in mind is that prior to COVID, mild to moderate mental illness was also a big issue, not just in the wider population, but also in the working age population. And I think that's really important to recognise. Over 38% of EU citizens have depression and anxiety, and many of those are working age. Only 25% get any treatment, and the direct and indirect costs of mental illness across Europe are very significant, as you can see there. I think it's also worth remembering a few key facts about mental health, which I think get forgotten a little bit, which I sort of trot out whenever I can. One, the quickest way to get support after an episode of psychosis is to get arrested. We've got really serious problems still about people getting access to clinical support, particularly for people with severe and enduring mental illness. So that's something that, parity of esteem hasn't really helped much with, or as much as we want it to. Secondly, the drug that's most commonly used to treat clinical depression is alcohol. Although we've seen obviously a big increase in the use of the prescription of antidepressants, there's a lot of depression and anxiety out there at an ambient level in the working age population that isn't really treated, and people are self-medicating, and that's a really important comorbidity that we shouldn't ignore. And then the third fact, which I like to entertain people with at dinner parties, is that 42% of all tobacco consumed in the UK is consumed by people with a mental illness. Now, there are other facts around, the impact of antipsychotic drugs on obesity and heart disease. This is a really complex area, and bearing in mind that it's time to talk day today, we really need to redouble our focus on not just mental health in the community, but mental health in the workforce. And so we're at a point now where we're looking forward to how the labour market might recover after the pandemic has gone. We're in a really serious economic dip and recession, and the job situation is of course very serious. We have some choices we can make about how we do that, and mental health should not be the first casualty of the jobs crisis. So I'm going to be asking about whether or not some of the changes that we've seen in employment arrangements and the type of work people do are exacerbating some of these mental health problems that we see in the working age population. Whether there are different levels of mental health risk that we're exposing people to and what we can do about that. And then obviously this point about what happens once the labour market starts to recover and what we can do to make sure that we're preserving mental well-being where possible. So I've got sort of three clusters of data or reflection just to share with you. First is just to ask this rhetorical question about whether or not any job is a good job. We've had a long debate for quite a long time now in the UK about job quality and what good work is. And it's almost become axiomatic that being in a good job is good for your mental health. But perhaps we haven't really got under the bonnet of what really what's the transmission mechanism between good quality work and good mental health. So I just want to reflect on that very briefly. Secondly, I want to ask whether there's a gradient of precariousness or precarity. I really don't know what the word is. None of them are particularly elegant, that exacerbate mental health problems. How have workers coped during COVID-19? I've got a couple of bits of data, both from a Europe-wide study and some reflections on some work we've been doing here in the UK. And then what are the post-COVID messages for employers and for policymakers? So let's go to this first point about whether any job is a good job. We often hear that being in work is the best way out of poverty and deprivation and so on. And for most people, that's largely true. It gives people dignity, gives them income, gives them connectedness, social connection, and so on, social capital, etc. But we also know is that in some countries with active labour market policies, which rely, which are very focused on getting people into any work, particularly where those rely on things like sanctions and conditionality, we may be making the mistake of assuming that being in any kind of work is going to inevitably be better than being out of work. And so all I want to do just in this next couple of slides is show you that that's not always the case. It's largely true, but we need to be really careful about it. So we know that being out of work is bad for income, self-esteem, social inclusion, and health, and so on. Being in even poor quality work, which is boring or routine, underutilizes people's skills, is, as I say, widely regarded as a good way for people who are out of work to remain connected to the labour market. Some of the work I've done looking at schizophrenia, for example, very strongly informed by the view that if you can get people with severe mental illness to do volunteering, for example, rather than to be in competitive work, that's going to be as good for their health. And actually the evidence is not that's not the case. It does seem from the evidence that poor psychosocial job quality can be damaging to people in poor quality works, and in some cases be worse for them than being unemployed. So here's some data from HILDA, which is the Australian labour market survey. This is data from Peter Butterworth and his colleagues of 7 ways of data from over 7,000 respondents. This is a household panel survey. And they looked at the relationship between employment circumstances, so people transitioning between employment and unemployment, for example, on job quality and mental health. And it looked at several different dimensions of psychosocial job quality. So these aren't all the elements of job quality, but those that focus on psychological well-being. There are clusters around job demands and complexity, job control, job security, and the balance between effort and reward. And they measure these in all these waves of the HILDA data to try and identify whether there are important differences between the people at different positions in the labour market, whether they're in high quality work, poor quality work, or unemployed. The key part of their reflection was that as they hypothesized, they found that those respondents who were unemployed had significantly poorer mental health than those who are employed. And this is the important bit. The mental health of those who were unemployed was comparable or more often superior to those in jobs with the poorest psychosocial job quality. Now, this is quite an important message, particularly for policymakers, as we focus on how we support people getting back to work after the COVID crisis and high levels of unemployment. And we know from similar analysis of the UK Psychiatric Morbidity Survey that very similar results have been shown in the UK context. So all I would do is say it's really important to recognise it's not clear-cut that mental health always thrives in every kind of work. And we need to think about the intrinsic quality of that work if we're really keen to make sure that the mental health of the workforce is an asset to UK productivity, but also a source of fulfilment and flourishing amongst individuals and their families. The second point I'd like to just look at is this issue of the gradient of precarious work and whether it's related to mental health. It does show up in several data sets, and I want to show you just a selection of data from the European Working Conditions Survey, which tries to explain whether or not there's a gradient in this precariousness and mental health relationship. This is an analysis conducted by my now former colleague, Judy van der Leyen, no relation, who's now gone off to do a PhD at the University of Leuven in Belgium. But she did most of the analysis, and we presented these data at a conference in Bergamo a few months ago. This is data from the 6 ways of the European Working Conditions Survey, country level data, supplemented by some additional data from Eurostat and the World Bank across all EU 28 countries. Remember that? The important thing is that these are employees. So we're looking at precarious work amongst people who are employed. It comes back to one of the points that Jill makes, is that precarious isn't just a binary thing about those people in work and those people who are on 0-hour contracts and so on. This explicitly doesn't include gig workers. These are people who are employees. And I guess therefore it's significant. If we even find a gradient in precariousness and mental health amongst people who are employed, that reinforces some of the points that Jill was making about there being this continuum. And then we need to look at the risk across the whole of the continuum. It's based on 27,000 employees. And we used a number of different employment characteristics to cluster jobs into 5 broad groups, each with increasing levels of precariousness. So from top to bottom, this basically the most stable at the top, standard employment relationship. I won't go through this in detail, but you get the picture. High levels of employment and income stability, predictable working hours and work schedules, regularity of working time, access to training opportunities, a voice at work, consulted on issues around safety, access to consultation and workplace issues. So there are a cluster of different characteristics, and what we did was to cluster everyone in the sample against each of these characteristics and place them into each one of these 5 categories. So at the bottom, the precarious and intensive group are those who've got high levels of instability and unpredictability, little control over working time, often where they had extra work that was unpaid, and other aspects of their working relationships with their employers, which were highly unstable and precarious, over which they had very little control and where they're pretty much at the whim of the employer. There are some spider charts, which I'm not going to dwell on. I did have a spider chart for every single group, but I decided to only show you the least and the most precarious group. This is the standard employment relationship groups. This is basically conventional permanent employment. The blue line represents the scores against each of these dimensions, so involvement, ability to set working time, predictability of work schedules, and so on. And then the yellow line represents the whole population. And you can see, therefore, that the blue line sitting outside the yellow line shows that in pretty much every dimension, those people in the standard employment relationship, as you might expect, have got as good as, if not better, working conditions than those in the population as a whole. And then if I go to the next spider chart, you can see that those people in the most precarious group, what we call the precarious intensive group, pretty much being superseded by the people in the yellow line, which is again the same as the previous one, the whole sample, and that on most dimensions that these people will experience the greatest degree of uncertainty, lack of control, and so on. Now, what we were interested in is whether there were therefore links between precarious work in our 5 groups and mental ill health. And we used the WHO 5 measure, the Index of Mental Wellbeing, which is a well-established and validated tool that we've used a few times. And indeed, we're using it currently in our study of people working from home. And we plotted where people with these 5 groups sit against the WHO 5. Slightly confusingly, the axis on the left-hand side, low scores represent good mental health. We should have changed them around and reversed the scoring. But you get the general picture that as precariousness increases, the score on the mental health measure, the WHO mental health measure, gets worse. The people in the portfolio group are a slightly weird group because it gets into there's some language issues here. You know, what is a portfolio worker? What's the difference between someone who's a gig worker and someone who's a freelancer, and so on? There are some linguistic issues here. But for me, the most important gradient is those 4 there, where you can see that there's really significant difference between those people in the most precarious group and those in the standard employment group. It's also important to bear in mind, see the note at the bottom, that we have controlled in this analysis for gender, age, occupational group, educational level, size of organisation, work intensity, ergonomic demands, job autonomy and cognitive demands. And what that suggests is that it is actually the sort of precariousness in terms of instability, lack of access to predictable working hours and so on, that seems to explain most of the variability in the membership of these groups. You would expect that people in whatever employment situation who have low control and autonomy and discretion would also have lower levels of mental health, but we've controlled for that even within this analysis, which just shows you the predictive power, the explanatory power of precariousness and at least in our measure, and the extent to which it explains why mental health outcomes differ so much. So in terms of what this all means, I think, as we said, we're showing significant relationships between mental health and employment relationships. We found that the UK, amongst all the EU 28, had some of the worst scores. And what it also showed is that it's not an inevitable relationship, that there are things that policymakers and employers can do to mitigate the effect of precariousness on mental health, and can reduce the harshness of this link. So as Jill's mentioned, there are a number of things that can be done around promoting good work, and of course doing some of the things we know are important around giving people access to occupational health support, providing people with jobs where they have more predictability over their working time, more variety and opportunities for learning, support and so on. And it just seemed to me that one of the big messages is that this is not inevitable. And therefore there are some choices to be made. And I think part of the debate about post-COVID recovery should be how we exercise choice and the extent to which the UK is really going to take control of this and do something about it, because the warning signs are there. And the danger is that we go headlong into a jobs recovery where we focus on the quantity of jobs rather than the quality of jobs, a bit like we did after the great financial crash of 2008. Just another couple of quick reflections from other data sources. The European Foundation in Dublin has been doing a survey of people working during COVID. I thought it was just worth reflecting on a couple of the findings from their data. I think this is based on 22,000 people across the EU 27. Notice the difference. So there's no UK data represented in this sample. And I just took a quick look using their rather good data visualization tool at levels of contractual insecurity of people during the COVID crisis. And we know from that before the crisis, about 2.5% of people across Europe were on contracts of less than 3 months. And you could see that in some countries it's a bit less than that, sometimes a bit more. There are lots more people in addition to that in non-standard employment contracts or bogus self-employment with significant contingent or precarious elements to it. And what the data shows is that job insecurity across this population during the early days of COVID fell from 15%, which was an immediate reaction to lockdowns and so on. It fell a little bit to 10% in July, but concerns really do remain about those people on fixed term and short term contracts. Over 40% of men aged between 34 and 49 on temporary contracts fear they may lose their jobs. And also, despite an increase in people's working hours overall, a third of respondents still reported working less time than before the pandemic. Over half of unemployed respondents across Europe did not receive any official financial support since the beginning of the COVID-19 outbreak. And of course, that forced many to rely on heavily on informal support. So it echoes some of the points that Jill was making about precariousness, not just being about contractual certainty. There's a whole range of other social support mechanisms that can go missing, which is also really important. I'd also just very quickly reflect that there is also something of a mental health gradient amongst those people working from home. At IES, we've been working with colleagues at Southampton Business School on an ESRC project called Work After Lockdown, which has been looking at the mental health of people working from home. And I recognise this group is a relatively privileged group, but again, we found a gradient here between people, for example, working way in excess of their contracted hours, young people working in very precarious or uncertain or cramped accommodation, people with low levels of control over their work, people with caring responsibilities, predominantly women. Again, that gradient is echoed in these data. We also need to hear a lot more about comorbid physical health challenges, and our data shows a strong link between mental health, musculoskeletal problems, people with long-term health conditions, people struggling with sleep and fatigue and so on. And all these things underpin the vulnerability of people to poor mental health. So final slide, the implications of this is that we know, of course, that job quality, intrinsic job factors like being able to manage job demands, control, discretion, decision and latitude, all those things that those of us who are organisational psychologists understand well, but so do to choices about labour market regulation, coordination, social dialogue and enforcement. It is interesting how poor UK has been in enforcement actions against employers who are not managing mental health well compared with other countries. Some of those comparisons are quite embarrassing. It's also significant that we don't seem to be replacing the current labour market regulation czar with anyone. So there's a big question about what oversight we have over the enforcement of existing labour regulation. We also know that some forms of non-standard employment can be beneficial for mental well-being. Some people really thrive on uncertainty or having a massive amount of control over their work, perhaps at the more entrepreneurial end. So we shouldn't just assume that non-standard employment is always bad. But of course, as we've seen, it can be bad for many people. So both policymakers and employers need to take a more informed and nuanced approach to make sure that mental health is not the first victim of a shift towards greater precariousness. And that means that any measures to get people back to work after the COVID-19 crisis and any moves towards greater labour market deregulation and promoting flexibility that result in widespread and sustained precariousness need to take full account of the risks of doing further harm to the well-being of a workforce which will already have had its stock of psychological resilience depleted by the events of the last few months. Thank you very much.
Thank you very much. That was a very interesting presentation that links really well with the previous one. One thing I'd like to flag while we're waiting for some questions in the chat box is that today SOM and a number of other organisations, including the Charlie Waller Trust, CIPD, Mind and others, have launched a consensus statement about mental health. It's available on the som.org.uk website, and there's reference to many of the things you've been talking about. So the impact of poor management, leadership, impact of pressures, both inside and outside of work. And the other thing that just hit me in the face all the way through both those presentations was how it links with the HSE 6 points for managing stress in the workplace. If any of you are interested in the audience, go to the HSE website and look for the management standards and things like job control and job demands. It's all in there. It's just music to my ears to hear it coming from you in this kind of a Public Health England / SOM venue. So could you let me just have a look at any of the questions? Oh, Joy Raymond to everyone. Is the reason that portfolio workers don't fit the overall trend on mental health and precariousness is that the uncertainty of their work is of their own choosing rather than imposed upon them, which is the common expectation for the most precarious workers. So Stephen, do you have any thoughts on that?
Yeah, I think that's probably part of the explanation. I think there was also, a bit of a labelling issue, but it does seem to me that, there's something slightly mystical about freelancers and people who are portfolio workers and so on. Obviously, there are issues around the ambiguity about what their actual employment status is sometimes. But I think there's strong evidence, and CIPD have done various surveys of this as well, that people who are exercising a high degree of choice and have opted for that way of working are doing so because they derive benefits from doing so. They're prepared to accept the risk that work might dry up and so on, but may have other support. I think that may, as Joy mentions, partly suggest why their mental health problems may be fewer, or they may be exposed to less risk of developing a mental health problem.
Thank you. One last question to you directly, Steve. In the EU countries where the relationship between precarity and mental health was different, were there notable policy or cultural differences that you would hypothesize influence the degree to which mental health is affected? And she's thinking in particular that the mental health figures for Denmark are usually particularly good, and this is often thought to relate strongly to different cultural attitudes. In essence, how much of this challenge can be tackled through policy change? So again, over to you.
Yeah, really good question. I mean, I think there are issues around societal norms and the extent to which people are open about discussing mental health problems, and stigma exists, and there's a massive difference across most EU countries. Tends to be slightly more enlightened in Northern European and Scandinavian countries. I remember doing a big project in Turkey where I was talking about the prevalence of musculoskeletal conditions, looked at the national data on the prevalence of mental health problems in the working age population. It was less than 1%. And that, just shows you that, I don't believe that it's less than 1%, but because of cultural issues and stigma and so on, just wasn't recorded. I mean, Denmark is a really good example. I mean, I talked about enforcement actions. Just anecdotally, my understanding is that the HSE have brought a very small number of enforcement actions against employers for being in violation of the principles of the management standards in the last decade. You can count them on, fingers and toes probably. Whereas in Denmark, over the last 5 years, it's been 1,400 employment enforcement actions. Now, I'm not saying that the heavy-handedness of enforcement is the only way of dealing with this, but we know from work we've just finished for EU OSHA in Bilbao, looking at musculoskeletal risk assessment, that employers in Europe generally are more likely to comply with regulations around prevention, risk assessment, and so on if they know they're going to get inspected. And it really does make a difference. And of course, UK employers are already required under the Act to carry out an annual psychosocial risk assessment, and they're not doing it. A few public sector organisations do, one or two very enlightened private sector organisations do, but it's not normal. And it is a requirement of the 74 Act. People don't do it. They're therefore not doing an assessment of the vulnerability of their workforce to mental health problems. And of course, data is one of the ways that you can start identifying this as an issue that you need to manage. Much more needs to be done than that, of course, but there's just one example of how in the UK we could just be a bit sharper around this.
I think that's a good point. The Section 2 of the Health and Safety at Work Act, which is the duty of care, and then other regulations that slot under it, really do put a focus on there is a need to check about issues in the workplace that could impact on both physical and mental health and well-being. This is a very good opportunity post-COVID to think about how we can build back better, but also build back fairer. And I think if we build back fairer, then that helps us to build back better. Thank you very much.
Can I just say,
you're going to say something?
It's really important that we, just linking you to your last point, that we recognise that work is a social determinant of health. And the fantastic focus that Michael Marmot and others have put on health inequalities and the role of employment in all this is, really been massively magnified by COVID-19. And therefore we need to think about what is it about the intrinsic quality of work that isn't just good for people's mental health, but also is one of the ways we're going to mitigate the widening of health inequalities. And I'm really grateful for the work that you and Public Health England do on that.
Thank you. Okay, right. Well, we're now coming to our final presentation, and our third speaker is Henry Chango Lopez, General Secretary of the Independent Workers' Union of Great Britain. So over to you, Henry.
Hi, everybody. Thank you for having me here. Yes, I'm the General Secretary of the IWGB Union, which is a union that represents migrant workers, but also workers who work in the gig economy, workers who are on low paid and in some of the worst conditions of employment, not just in conditions in terms of sick pay, holidays, or pensions, but also in terms of not having any rights like workers in the gig economy, like couriers and other workers in that industry. Obviously, for us, this is not something new. As a union, we've been fighting before the pandemic in order to improve the conditions of these workers. And in a way, although this is a very bad situation, which it has exacerbated the problems that these workers have, has been helpful in a way to expose the reality of precarious workers in this country and the conditions they have been working for many years. And this is something that we as a union have been fighting for and improving the conditions with campaigns that we have run. Now, the problems that how this has exacerbated the issues that workers are having at the moment is with the low conditions of employment that they have, which, for instance, in terms of sick pay, we believe that this needs to be higher and needs to be a universal. Like UK statutory sick pay is one of the lowest in Europe, needs to be equivalent to the living wage of pay with a cap. It also needs to be universal and accessible, especially for those who don't meet the income threshold, because their need is most. We have cleaners, for instance, who have many jobs where they work 2 hours, where they cannot access sick pay, for instance. In terms of furlough, the scheme must be extended and enforced by the government. We see so many workers who could have been placed on furlough, but are made redundant, so the company can, save marginal costs. This shows we cannot leave this up to the discretion of for-profit companies. Government needs to compel companies who can afford it to use it. We also need the program to be extended for at least a year. Each time the government announces at the last minute extension, it creates countless of precarious workers who have been put in redundancies, basically terminated their employment. And then after that, when the government through the furlough, these workers don't get back to work. Basically, the companies don't take them back. In terms of health and safety enforcement, we need the closure of non-essential buildings and proper health and safety enforcement in those that remain open. At the moment, there is no enforcement with the health and safety executive responding to few complaints now than ever. The pandemic, basically less than 1% complaints. Yeah, this is unacceptable when over 100,000 people have lost their lives. We also need improvement in terms of whistleblowing protections for precarious workers. We recently have to take the government to court through a judicial review in November, which we won, and which gave the workers the right, give gig economy workers basically the right to refuse to work in unsafe conditions. But at the moment, that is just the right thing to make yourself destitute, and not enough to protect public health. In terms of self-employment income support scheme, basically it's letting down countless of precarious workers who are falling through the cracks. We believe that the criteria need to be relaxed so it's accessible to everyone who needs it. Workers and their families are being plunged into poverty regardless of whether they meet the restrictive criteria for self-employment income support. For example, they need to have traded in both 2018, 2019, then 2019, 2020, and submitted the self-service tax return, or on before 23rd of April 2020 for that year. And so these basically are creating problems for these workers. And we've seen, like, in terms of evidence, the government failure to make furlough compulsory and to enforce health and safety guidelines means that many employers have decided to dismiss employees in mass. One example we have is one hotel called Guardian Hotel, who proposed to make 1,200 redundancies in one go. One of these cases, one of the cases opened in 2020 by our legal department, we have 133 related to redundancy, much more than the normal time. The only recourse for our members to survive was to resort to benefit. As a union, in order to tackle and to help these workers, we have created a benefit team, which was swamped with the request for help with universal credit, applications due to the unprecedented wave of redundancy. It ran from March to September. It finished during the lack of resources. Obviously, we are a small union with low resources, but we have tried to help our members as much as we could. We received over 170 requests for assistance, mostly with universal credit applications. 100 of these came from migrant Spanish and Portuguese-speaking members. Many don't have the technology like computers to make universal credit applications, nor they can speak English, so the need for support is desperate. The government failure to properly enforce health and safety guidelines is putting lives and the public health at risk. Out of the cases opened in 2020 by our legal department, 134 related to furlough. We have also had a very high number of cases concerning members' sickness due to COVID-19 and health and safety issues at workplace, with employers failing to provide PPE or implement basic health and safety measures. And in one case, for instance, we had a cleaner who went to work with symptoms due to the fact that she couldn't afford to remain at home on statutory sick pay. And later, she tested positive for COVID. So this is some of the issues that these members are having, and why we think it's very important for the government to improve this. In relation to furlough, we have the case multi-million cleaning company like Italian Service, who are currently in the process of dismissing over 100 cleaners who will face destitution unless furlough is made compulsory. We have had cases when the employees' national insurance tax contributions is zero, as the employees don't meet the threshold, or as low as £88 per month. And even then, companies have refused to utilize furlough despite costing them nothing. We had a case of a cleaner who nearly lost his life last year due to COVID. He was in hospital with lung deficiency and intubement. We have asked them to put the worker on furlough to protect his health, and the company has refused to do so. We had a case of non-essential buildings being opened. There are many universities like the University of London, UCL, Goldsmiths, and others who have been asking hundreds of cleaners and security guards to attend work despite COVID infections reaching terrifying heights and the NHS on the brink of collapse. As a result of this, just in one case in UCL, which is one of the biggest universities, we have 19 security guards members who got infected with COVID, with one of them infecting his mom, who sadly passed away, which is terrible, bearing in mind that these buildings should have been open in the first place unless it's needed. But if it's needed, not at all capacity. We have the case of like workers, cleaners in Royal College of Art, where they are refusing to close the building, and we have already cases with positives amongst cleaners. So we think that workers' rights are not a public health issue. When it comes to frontline workers, they are all essential. Yet what we've seen in practice is a two-tier system which is exploiting precarious gig economy and migrant workers. The human impact of this system is more devastating than ever. In fact, it is worse than that now. It is dangerous. It is endangering public health. The best way to fight this virus is fighting for our front line, and that is what the IWGB has been doing. Across key sectors, we are seeing precarious workers still being exploited with little to no regard for their health and safety. And by extension, our government needs to take responsibility because for the workers and not for companies. Essential rights for essential workers, that is a key lesson. I think this crisis is teaching a lot of people, a lot of these key workers, these on precarious 0 hours contracts, many of them migrant workers, once dismissed as unskilled or casual, they have helped keep the nation going through this pandemic. We think the least people ought to be able to expect is dignified conditions at work, and they cannot work or get sick pay. So basically, essential rights deserves, essential work deserves essential rights, and that's why I think should be given to the workers, and this is what our union has been doing in order to protect these workers. Obviously, it's been a very difficult situation for us as a union. We have been doing our best. We have been having a very difficult situation in terms of keeping with the work, especially for these workers, but we're doing our best in order to help them. Thanks.
Thank you. That was a really interesting presentation, and the work you're doing in your union for these people who are particularly vulnerable, either because of the kind of work that they're doing, and also you've mentioned some of the issues with people from overseas. Maybe some of those people are living in multi-generational households. Again, that increases their risk factor. So you're doing some really sterling work there. If you'd like to contact me off list, I might be able to help you with some health education information, but we'll do that as a separate issue. But thank you so much. I really enjoyed your presentation. We've got some comments coming up in the chat box here, and this has come from Stephen. It's not a question, it's an observation. Just to remind everyone, following my point about the HSE standards, that role conflict is an important dimension of workplace stress. And his guess is that this has been elevated or amplified for many during COVID-19, especially with homeschooling. Of course, many working mothers know only too well what this feels like, so it's not a new phenomenon. What is different, though, is trying to maintain your work-life balance, your psychological well-being, carrying on with work from home while you've got children that you're trying to homeschool, or if they're younger children, doing all sorts of disruptive things that might be dangerous, and you're distracted between looking after them and also your work outcomes. Here we are, a message from Gail. Oh, before I talk about Gail, Nick has put in the chat box higher up the link to the SOM website, which has that consensus statement. And also there's information for you, Henry, on lots of things from SOM. If you drop me an email, I can point you in the direction of some of those sheets that might be helpful for you. Where was I? It was from Gail. Thanks, Henry, for reminding us that behind all of the statistics are individuals who are working in very challenging conditions. It's wonderful that you and the IWGB are working so hard to give them a voice. And I think the support that you're giving them, helping complete applications for benefits, particularly as many of them may not speak English as their first language, and the fact they might not have a computer at home. We assume that everybody has got access to the internet, and that plainly isn't the case. They may not have the hardware, the computers, but also there's an issue that takes power, and you have to pay for power. And if it's a case of paying for food to feed your children, or paying for power to get on a computer, I know where most parents would put their money, and it would be feeding their children. Where else? What else have we got here? Steph Abra. Thanks, Henry. Is there any information you have on the mental health of migrant workers working in these very challenging conditions? So that's over to you, Henry.
Yeah, obviously we have been trying our best in order to support our members with casework being at the maximum level. In terms of health issues, obviously we have many workers who are in difficult situations. Some of them losing their homes because they haven't been furloughed. But we dealing with this issue as it comes. Basically, we work with Latin America, with LORS, which is Latin America Women's Organization, in terms of helping Latin American workers who help with health issues. We work with them, so we provide trainings on this as well in order to support them, and we signpost them there when we have this when workers are having these issues.
Thank you. From Christy, how do you, Henry, and the IWGB find organising workers that are so very vulnerable? Are people too afraid or exhausted for collective action? So Henry, that's for you.
I think yes, being afraid, yes. I used to my life as a trade unionist. I started at University of London, fighting for conditions. I've been afraid of being sacked from my job for asking for something that we deserve. So it is something that happens in every workplace, with workers being scared because they don't know their rights and they obviously been exploited. But at this moment, our union has grown in membership because workers have realized that it's only by being involved in a union that they're going to get help and support. So I think we are doing that at the moment and organizing workplaces where before they haven't been organized. And I think workers are up for challenging in these times to protect their jobs. So I would say yes. I think we are doing that, organizing workers, and I would really like to use this opportunity to ask for your support. Obviously, these workers need support not just from the union but from everybody. And we have like Twitter IWGB, Facebook IWGB, where we have petitions and we're asking members of the public to support with this campaign. We have been very helpful when we have launched in order to protect the life of these workers. Thank you.
Thank you. What SOM are doing is trying to highlight the important need of access to occupational health services for everybody, so universal access, and we're really trying to promote that. And it's particularly important for people in occupations where they are facing psychosocial stressors or physical or biological stressors. What horrified me was when you mentioned about some of your members not having access to personal protective equipment. Well, that's putting their life at risk and their health at risk, but also other people. So access to PPE is essential, and it is actually a legal right under the PPE regulations. I'm not going to go into all the legal side. I could write a book on it. Nick has said that if you want to book for future webinars in this series and other series, he's given you the SOM, not you personally, Henry, everybody, the SOM website for those. The 11th of February is another webinar looking at managing stress, burnout and fatigue in health and social care. 3rd of March, developing a COVID secure health and wellbeing strategy. And the 10th of March, managing change from restructuring, redundancy and home working. Question here from Chris Warhurst. What do the speakers think of suggestions emerging from the UK government that it might loosen up exclusivity clauses to enable low paid workers to work in more, the question's moved up, more low paid workers to work in more low paid jobs, i.e. having multiple jobs. As people put comments in, the comments move up the screen. So let me just read it again. What do the speakers think of suggestions emerging from the UK government that it might loosen up exclusivity clauses, enabling low paid workers to work in multiple low paid jobs, i.e. having multiple jobs? So can I put that over to Stephen, please?
Yeah, it's a good question, Chris. I mean, it's double-edged in some ways. I mean, obviously, there are situations where people in roles where they have no guaranteed hours have been required by employers to basically sit around all day waiting for a phone call to see if there's any work for them, and they've been excluded from working from anybody else. And obviously, that puts the employer massively in control and puts someone at massive risk of having very low earnings and high precariousness in their earnings and so on. So loosening that up at least would release people from that sort of tyranny. The danger, of course, is that then people will naturally, of course, as we've seen during the crisis, perhaps expose themselves to increased risk by working too many jobs or working excessive hours, or putting themselves under massive pressure. And we also know, I've been looking at some of the self-employed data in construction that came up in an earlier question, that financial insecurity really forces people to work as many hours as they can, and that puts their home life at risk. So it may give them a bit more financial security, but actually they then become a bit disconnected from the rest of their family, and that obviously affects their psychological well-being as well. So I mean, I think it's good that people will be released from sitting around for 20 hours a day waiting for a phone call with no guaranteed earnings. But at the same time, I think it's important that we have safeguards to protect people from working excessively or being exploited.
Good point. Nick has put a link up. A letter to Rishi Sunak was sent yesterday from SOM with that link, which is on the SOM webpage. Nick's also highlighted about a call for a review of risk assessments with the new COVID-19 variant. Many employers think, oh, we've done a risk assessment, we'll file it under U for useful, and that's it, job done. But in fact, risk assessment should be something that is ongoing because things do change. Again, some have done some work on risk assessments for employers at the start of the pandemic. So just to flag up, to have a look at the SOM website.
And can I just add that in the survey we've been doing of people working at home during lockdown, we've seen a general elevated incidence of musculoskeletal pain, but amongst those people whose employers had done a risk assessment and provided some ergonomic advice, the risk of musculoskeletal pain was vastly reduced, as was comorbid mental health problems. So employer action here does make a difference, even if it's a symbolism of your employer looking like they're taking care of you, that can make a difference as well. But helping people to make adjustments to their physical working environment can help their mental health too.
That's a really good point. Thank you for flagging that. One thing I've found is it's so tempting to put meeting after meeting after meeting, all via Zoom, into your diary. By the end of the day, having tried to read these little chat boxes, I can't even read a newspaper. So I think doing those risk assessments is so important. And I know what I should be doing, but unfortunately, I'm not necessarily always practicing what I preach. One thing as a tip for everybody, when you're on these kinds of webinars, to periodically look out into the distance, blink a few times, do some stretches, so that you can then read the material on the screen and not, I'm not saying damage, but not fatigue your eyes. There's some more comments here. Nick's put the link from the SOM website for universal access to occupational health. That's a really important public health strategy. If people have access to an effective occupational health service, that in itself is a good public health approach, because we can do things such as the risk management, we can think about COVID. My concern now is that the issues in the future is going to be the effects of long COVID, and therefore helping people back to work with those symptoms, which are peculiar bunch of things. There are issues that can affect the physiology, affect the psychology, affect heart, all sorts of things. And therefore, to try and support those people back into the workplace, occupational health are going to have a very crucial role. Have we got any more questions here? They're coming up here. Oh, Nick's very kindly put the link to the SOM website for return to work toolkits with risk assessments, home working, etc. I think that might be all the questions. Is there anything that the panel, because we've got the grand total of 4 minutes left, is there anything that the panel want to add, having heard everybody's presentations, that might inform us all better? And I'm counting me in that.
Could I come in?
Who was that? Is that Jill? Hello,
yeah,
Jill.
I'm not putting my video on because I'm still having problems with the internet. I just wanted to come back on the question about loosening up this exclusivity. I think it feeds into what I was saying about responsible employers. The point is whether employers can not give people work, even if they're not allowed to impose an exclusivity clause. So actually we're putting all the burdens onto the employees to find enough work by working for more employees. And we're not putting any burdens on employers to make certain they have decent guaranteed hours. And if they do take jobs with other employers, then and they're not available when their current employer asks them to work, there's nothing to protect them from being dismissed. So I mean, the strategy is a non-starter in the sense of protecting workers and providing opportunities. The exclusivity clause is a red herring when actually employers can impose it because they can sack them if they don't observe it.
Yeah, and particularly in the gig economy, that is that's an additional facet which has an impact on people's income and therefore their well-being and their general health. Okay, well, we're now coming up to 2 minutes to go before the magic hour of 3:30. I'd just like to pick up a few things here. Good comments about the exclusivity point from Jill and Steve. I'd also like to thank Public Health England for initiating this series of webinars. We're delighted to work with you. And also to Gail, because Gail, you've done so much. Thank you. You've done an awful lot with us at SOM, and you have been instrumental in driving these particular series, of which there are quite a few, and you're keeping up to date with all the presentations, and then you're putting together some additional materials as sort of tools. I'll send you something you might find useful, and I'm also going to send that to you, Henry. I'll get your email address. So finally, just to thank everybody and to say we finished at 3:29. I'm not going to wait until the clock ticks over to 3:30. So goodbye, and please come and join us on some future webinars. The ones I've listened to all of them so far, and they've been really fascinating. And thanks for your hard work.